occur out of necessity if the management aspect is not well taken care of.
The environmental impact assessment is a procedure used to examine the environmental related consequences, both beneficial and adverse, of a proposed development project and to ensure that those effects are taken into account in the project design.
The environment impact assessment therefore becomes a statutory requirement for certain projects and plans with enactment in 1994 of the National Environment Management Act, in which Section 23 states, no license or permit under any law shall be granted to any person designed to develop a project specified in Part A of the schedule until he or she comply with the following provision of the section.
The World Bank consultant, Upoli Dasanayake, said the exercise is in consonance with one of the requirements of the World Bank's principle, which dictates in whatever you do, do no harm.
We are gathered here today to familiarize ourselves with the policies triggered by the latest bank-supported education project for the Gambia, and to discuss how we can share the responsibility of implementing this project in a manner that will not only protect the people and the environment from undue harm, but also to explore ways to prevent and improve the natural and social environment that concern the project. So, as mentioned before, we have developed two safeguards instruments for the project: an environmental and social management framework and a resettlement policy framework, which we will discuss in detail as the day progresses.
The validated documents, now the working tools in addressing the potential negative environmental and social impacts of the results for education achievement development project. Prior to its implementation, as P.S. Boy puts it, is the answer to the slogan, development should be a blessing and not a curse on beneficiaries. Samuel Ba, GRTS.
The Director General of the Presidential Alternative Treatment Program, Dr. Tamsinbo, wishes to inform the general public that all those who registered for the infertility treatment are to meet at Kanilai Alternative Clinic in Bakau on Tuesday, December 3rd at 10 a.m. Those who registered for the HIV/AIDS treatment are also requested to report to the same clinic on Wednesday, 4th December at 10 a.m. The Global Anti-HIV/AIDS Coalition is seeking to ensure new zero HIV/AIDS infections, zero AIDS-related deaths, and zero HIV/AIDS related stigma and discrimination. Campaigners, health workers, and other partners on Sunday gather in Soma Lower River region under the edges of the National AIDS Secretariat, Action Aid, and other stakeholders to mark World AIDS Day. Mamadou Bajan was in their midst, and he now tells us more.
The rest of the world to commemorate World AIDS Day in the Lower River region town of Jarasoma. After the welcome remarks by the governor of LRR Salif Poi, the event, which was attended by people from different walks of life, kicked off with a march past by students, civil society organizations, NGOs, and security agents. Since the discovery of AIDS, the fight against the pandemic has been relentless. The National AIDS Secretariat, in its anti-AIDS crusade, deems it a collective responsibility to advocate for universal access to prevention, treatment, care, and support towards the attainment of the 3 zeros. With this year's theme, Getting to Zero, the Minister of Health and Social Welfare, Omar Sy, who also graced the occasion, dilated on this.
Getting to Zero is the theme set by the World AIDS campaign to commemorate this year's World AIDS Day. This new theme will be used until 2015. They echoes the national and international vision of achieving zero new infections, zero stigma and discrimination, and zero AIDS-related deaths. In the Gambia, the National AIDS Secretariat, Action Aid International de Gambia, and the Ministry of Health and Social Welfare continue to spearhead the HIV and AIDS national response in partnership with other stakeholders.
The Director of NAS, Usman Baji, and several other speakers touched on the gains and challenges that exist in the fight against HIV/AIDS.
The day is intended to bring us together and take stock of the successes that we have registered, and as well acknowledge the challenges that we continue to face in the crusade against HIV and AIDS. The Regional Director of Health has made mention of the available services, but just to reinforce his statement, we have gone past the era when people should die of HIV and AIDS.
Zero discrimination and zero AIDS-related deaths. Worldwide, the number of new HIV infections continue to fall. More people have access to antiretroviral treatment, and as a result, fewer people are dying of AIDS. Yet progress can be fragile and momentum tenuous. Inequalities, social exclusion, stigma, as well as discrimination continue to hinder access to life-saving services and commodities for far too many, including women and young people, especially those from key populations.
The Pakalinding Peer Health Group's participation in this year's event featured a drama depicting some of the challenges faced by HIV/AIDS patients. In their piece, they buttressed the causes and effects of stigma and discrimination, as well as advocate for voluntary counseling and testing. These students were followed by traditional communicators who also used music and dance to educate people on the need to fight HIV/AIDS. Aissatou Diop of Jara Kanikuna urged all individuals to desist from stigmatizing and discriminating against patients, and also appealed for them to go for voluntary counseling and testing so as to know their status.
Based on evidence on the HIV regional situation, this year's World AIDS Day will be observed in the LRR region. Recent studies show that the prevalence is highest in LRR as compared to the rest of the country. As we observe this year's World AIDS Day, it is paramount for us all to remember that positive behavioral practices are quite critical in halting and preventing HIV in the country.
As more people die of AIDS in Africa than any other continent, the high rate at which the pandemic spreads in a small country like the Gambia is being frowned upon by health experts. This and the latest revelations that Lower River region has the highest prevalence rate in the country requires more urgent measures, perhaps through a participatory approach to continue the war on HIV. Modu Bajan, GRTS News.
We'll be back with news from outside the Gambia after this break.
The distinguished patronage of His Excellency the President, Chair Professor Dr. Alhaji Yahya AJJ Jammeh, the organizing committee of the Miss 22nd July Scholarship Pageant proudly presents the finals of the 5th edition of the Scholarship Pageant, taking place on Saturday, December 7, 2013 at the Penchemi Hall, Paradise Suites Hotel. The Scholarship Pageant is geared towards promoting excellence among girls in line with Vision 2020 for sustainable growth and development. The pageant is a display of academic potentials, talent, and beauty. The theme for this year is promoting positive attitudinal change for sustainable development, the role of the youth. Support the Miss 22nd July Scholarship Pageant as the scheme will benefit all and sundry.
Welcome back. South Africa's Vice President has announced a nationwide campaign to minimize the risks of HIV and AIDS infection in the country. The Vice President made the announcement Sunday while undertaking the AIDS test in observance of World AIDS Day. As we hear in the CFI News Roundup report, there were 400,000 new cases of HIV/AIDS last year alone in South Africa, with 12% of the population living with the virus.
And Vice President Galeme Molanphe symbolically and publicly underwent an AIDS test on International AIDS Day Sunday. He wants to incite fellow South Africans to follow his example. He also announced the launch of a nationwide campaign to circumcise men in the country to lower the risk of AIDS contamination. There were 400,000 new cases of AIDS last year in South Africa, which makes the country one of the worst hit in the world, with 12% of the population who has the AIDS virus. Representatives of 5 East African countries met in Kampala, Uganda to discuss launching a common currency. The 5 countries concerned are Burundi, Uganda, Tanzania, Kenya, and Rwanda. They signed an agreement which should lead to setting up a common currency in 10 years. The goal is to develop regional trade and attract foreign investors. 130,000 residents are concerned.